Hi everyone, and welcome to Module 3, Assessment and Care Planning. In this session, we'll talk about how to truly get to know each person living with dementia, so that the care we give fits them perfectly. Every person has a story, a routine, and a set of needs that make them unique. A whole person assessment helps us discover those details, not just medical facts, but what matters most to the individual. It builds trust, strengthens relationships, and helps us plan care that supports both the mind and the heart. So, what should a good assessment include? There are 7 key areas to look at. Cognitive status, how well the person remembers, makes decisions, and communicates. Functional abilities, what daily tasks they can do independently, like bathing or dressing. Dementia-related behaviors, any signs of agitation, wandering, or resistance to care. Medical status, their health conditions, medications, and any pain or discomfort. Living environment, what's familiar and comforting in their home or room. Safety risks, hazards like fall risks, poor lighting, or cluttered areas. Life history, the person's background, relationships, interests, faith, and special memories. Of these 7, life history is often the most powerful. Knowing a person's past, what kind of work they did, their hobbies, favorite foods, or even how they start their mornings can make a huge difference. For example, if someone was once a teacher, inviting them to help organize papers or read aloud may give them a sense of purpose and calm. Life history helps turn moments of confusion into moments of connection. Good assessments do not happen alone. They involve many voices, the person living with dementia whenever possible, their family or close friends, caregivers like you, and healthcare professionals. Together, we build a complete picture that helps everyone understand how to give the best care. When should assessments be done? They are not one-time events. They should happen at the start of care, and again every 6 months, or anytime there is a major change in health, behavior, medication, or living situation. Try to assess the person when they are calm and alert. That's when you'll see their best abilities. Now, let's talk about the care plan, the roadmap that comes from your assessment. The care plan should highlight the person's strengths, promote independence, and preserve dignity. It is a living document, reviewed often and updated as the person's needs change. And most importantly, it should reflect the person's own voice and wishes. Here is a quick example. Marilyn enjoys music, likes to sleep in, and prefers socializing later in the day. She becomes anxious before dinner and tends to pace. Her care plan might include music activities, morning rest, and calm walks before meals, all tailored to her rhythm and comfort. That is what personalized care looks like. Finally, remember, good planning also means looking ahead, talking early about a person's values and wishes helps families make decisions that truly honor their loved one's preferences later on. In summary, a full assessment covers cognition, function, behavior, medical status, living environment, safety, and life history. It is an ongoing process that involves teamwork and compassion. When we assess carefully and plan thoughtfully, we don't just provide care, we provide understanding, dignity, and quality of life. Thank you for the care and attention you give every day. See you in Module 4, Activities of Daily Living.